Okay, now we're going to do the range of motion for the joints on the lower part of the body. When we do range of motion, we always want to do it in an organized fashion. So we usually start at the top of the body and we work our way down. Also, there are joints in the lower half of the body that are similar to the joints in the upper half of the body, and we'll do similar types of motions with those similar type of joints. For example, the shoulder is a ball and socket joint, so is the hip. So you're going to have similar type of motions in both joints. Your elbow is a hinge joint, your knee is a hinge joint. Again, similar type of motions in both joints. We're going to start with her hip. We're going to first do flexion and extension. There's two ways that you can flex the hip. You can flex it this way and extend it back, or you can flex it this way and extend it back. Which way you use will depend on your patient's abilities, doctor's orders, and notes in the care plan. I'm going to demonstrate both methods for you. Flexion, extension, flexion, extension, flexion, extension. Flexion, extension, flexion, extension, flexion, extension. Next I'm going to do abduction and adduction. We've got abduction, adduction, abduction, adduction, abduction, and adduction. Finally, there's internal and external rotation. We have internal rotation, external rotation. You see the whole leg is rotating. Internal rotation, external rotation. Internal rotation, external rotation. For the knee, we're going to do flexion, extension, flexion, extension, flexion, extension. Now we're going to move on to the ankle. We have dorsiflexion and plantar flexion. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. For the foot, we have supination and pronation. Supination, pronation. Supination, pronation. For the toes, we have extension, we have flexion. Extension, flexion. Extension, and flexion. For abduction and adduction, abduction, adduction, abduction, adduction, abduction, and adduction. Those are the range of motions for the lower joints.